And it's 6 o'clock and we love to get started on time. So today we're going to talk about something I know that seeing all the early birds, that you're just as excited as I am. We're going to be talking about how to get glass skin. We've got with us Dr. Anupriya Goel, who's a renowned skin specialist. She's the medical director of Berkowits here in Skin Clinic, and she's recently just published her book. And we've all heard about these Korean beauty secrets. I mean, they're all the rage. But what we're going to find out today that this glass skin is just not limited to Koreans. Each one of us can get this flawless, this dewy skin, which we're already seeing on the doctor. So let's not get jealous yet, because by the end of this, we will all learn how to get this. And this dream, though, I mean, I think she does warn us, cannot be achieved overnight. So the book will actually take you all the steps to be followed in your morning to night routine according to your skin type and your skin condition. But today we're going to get a good glimpse into that. A little bit about Dr. Anupriya Goel. She's a renowned skin specialist and she's the medical director of the Berkowits chain of clinics. She gives us an insight also into the right kind of nutrition and supplements that we should also be taking, along with an understanding of the active ingredients that we all need to know before we invest in a product. This and the latest advancements in skincare. So today people are going to say, what are we waiting for? Let's see how our skin can become glass-like and let's get addicted to this glow. So Dr. Anupriya, a very, very warm welcome to Sipping Thoughts.
So much. Thank you so much for the elaborate introduction. And I'm so excited to be here. I'm so excited to interact with so many people. Already 76 participants are here, and I'm hoping that we see more and more participants. And I'm really looking forward to an interactive session. So all of you, please keep interacting with me. We'll have an interactive session. This is not a lecture from a doctor to all of you. This is an interactive session where you'll ask your questions and I'll answer them.
And so Sarindri has already bought the book. All right, way to go. I'm gonna ask this question because people that know me on Sipping Thoughts see I do such a host of topics. But when we talk about beauty, people usually always associate it with vanity. I'd like to get your thoughts on that because we're all interested in the topic. I'm just as much interested in how to get great skin as I am. But when I feel like I'm talking about this topic, I somehow feel, am I being vain? I'd love to hear your thoughts on that, Doctor.
So, everybody in life, and also me, we all look for the best, best results, whether it is us giving any exam, we want the best scores. When we are talking about fitness, we want to be fit. When we are talking about, buying a phone, we all want to have the best technology. And when we are talking about skin, we all want healthy and glowing skin. I have seen this, that there has been a ritual to say that, you should adjust with, even if you have moderate results, or you should adjust even if you don't have the best. Why should we adjust when we can achieve the best? And that's what we also say about skin, that why can't we get the best healthy and glowing skin, which looks glass-like, and enjoy it and have confidence with our skin, have confidence with ourselves. After all, our skin represents ourselves. And to tell you a fact, how many days do you wear jewelry? We spend in so much money on our jewelry. We spend in so much money on expensive bags or clothes, but you don't carry one expensive bag every day. You don't wear that jewelry every single day, but you carry your skin every single day. So what should you invest in? Should you invest in that expensive set of jewelry, or should you invest in your skin to make yourself look flawless and also be happy about it?
No, I would love it because I definitely do agree with you. The second question, I think everybody is dying to know this. So I'll just jump right into it. Tell us your day and night routine. What do you do as a doctor before we get into how we can all get this glass-like skin? So how many hours does it take? Is it easy and something that all of us can do?
Well, it does not take hours at all. It just takes 5 minutes in the morning and it takes 5 minutes in the evening time, and you have to follow the simple skincare routine. However, when I tell you, you will find that, oh my God, how many steps? But trust me, once you start doing it, you will feel that, oh, it hardly takes 2 to 3 minutes, but you have to be consistent. Every single day, AM and PM routine, even if you're traveling, even if you're at home, even if you're feeling lazy, if you've come back from a party, you have to follow an AM PM routine consistently. So what is my skincare routine? Well, you have to first choose the right face wash for yourself. So I cleanse my face, then I spray a toner according to my skin type. That's not a necessary step, but because I make sure to follow all the skincare steps which are necessary for my skin every single day, I spray a toner, then I apply a serum according to my skin condition. So I have a little pigmented skin. I have some dark spots here and there. So I apply a face serum followed by application of a moisturizing sunscreen. So because I have combination skin type, I sometimes skip application of a moisturizer and I apply a moisturizing sunscreen, immediately after I apply my serum, because sunscreen is the most important step in your skincare routine, whether you're indoors or you're outdoors. So you must apply a sunscreen. So I apply sunscreen quickly. And then if I have to go out, I apply a little bit of BB cream and that's it. That's my AM routine. That's my morning routine. Now, if I have to follow a PM routine, the most important thing, if I have come from outside and there's a little bit of dust on my face, I make sure to remove off that dust with the help of some makeup remover or a micellar water or a cleansing balm. I remove that off. That's called the first cleanse. And then I second cleanse my face with a water-based cleanser. That is a face wash again, a toner, a serum, and a moisturizer. And that's all. So this might sound very complicated to you, but it takes 10 seconds to spray a toner, 10 seconds to apply a serum, and 10 seconds to apply a moisturizer. So in total, my day care and night care routine is hardly 5 to 7 minutes. That's all.
Now, is this good for all ages? Because I know that's the next question. So I know that especially depending on your skin type, you can change the product, but all age groups can actually follow this routine that you have suggested?
Definitely yes. Definitely yes. All that you need to take care of is what is your skin type and what is your skin condition. That is the most important thing. So you all must have learned about skin types. Everybody knows about skin types, but skin condition is something that we'll delve on in this session today, so that you all know about your skin condition as well, and you can choose the products according to your skin condition as well.
Now, my third question, we're all stuck indoors. We're obsessed with DIYs. Everything has become a DIY. So do the DIYs work as well as the salon and the spa treatments? And can we get these magical results?
Not that DIYs don't work, but the only problem with DIYs is because they are so approachable. They're there right in the kitchen. Everybody overdoes DIYs and they become dependent on DIYs. They feel that if DIYs don't work for me, then no medicine can work for me. But that's not true. The creams that we recommend as doctors, they contain special actives which are meant for your skin condition and skin type. So trust in the commercially available medicated creams as well, because they really help in improvement. Now, DIYs, they can be classified according to your skin types and skin conditions. So you must, whichever DIY you choose, you must know that, okay, this is the DIY I'm using, which suits my skin type. And you should not do it more than 2 to maximum 3 times a week. Maximum 3 times. Do not follow a DIY in the morning and at night, and think that, okay, this is going to do wonders. Some people apply aloe vera gel as a routine, but make sure that your skin is not allergic to aloe vera gel. If you're applying aloe vera gel every day, that's fine. That's not a DIY mixing many ingredients. But a lot of people, they mix a lot of ingredients, in a DIY, and then they expect that, okay, this will do the best. Now, also one problem that I have with DIY is that sometimes when you get active acne, you depend on DIYs to completely cure it. Do not depend on DIYs for active acne. Please do not. You can use a DIY just for, enjoying your skin and for getting a good glow sometimes, but not as a treatment for any type of skin condition.
Well, thank you, doctor. And I know everybody is dying to know now how to get glass skin. So I'm going to turn it over to you.
All right. So let's get into the steps to get glass skin. Now, I want to ask all of you that how many hours do you sleep in a day? If everybody can just tell me, how many hours do you sleep in a day? And some people were asking about that they did not get the name of the book. It is How to Get Glass Skin. You can easily get it from Amazon, and you can just type how to get glass skin. All right. So a lot of people are writing 6 to 7, 6 to 8, 6, 7. Sunita is saying 6 to 7 hours. Manisha is saying 6 to 8. Dr. Sheila said 5 hours. Dr. Darshana says 6 to 8.
I
Okay.
love it, Ankit. You're getting 9. I got to learn from you.
So I'm so happy that most of you said 6 to 8 hours minimum. So I usually sleep for 7 hours, sometimes 7, sometimes 8. And do not feel guilty if you're sleeping for 7 to 8 hours, because that is something that your body needs, and that is something that your skin needs as well. And I call it as beauty sleep. Sleep is very, very important for you, most important for your mind, for your body, and also for your skin. It's really, really important. So the first step, you must sleep every single day for at least 6 to 8 hours. So I'm so happy most of you are following it. But some people who are, sleeping just for 5 hours, please sleep for 6 to 8 hours. Have a good night's sleep, and do not be stressed. Do not overthink while you're sleeping. And that is extremely, extremely important for your skin as well. Okay. Now, I would like to know from all of you okay, so all of you must be knowing about skin types. I know that, most of you know about skin types, that there is dry skin type, there is oily skin type, combination, normal, and sensitive skin type. Does anybody of you know about skin conditions? If you can just take a wild guess that what kind of skin conditions exist. Okay, so Sukirti said acne. Someone said dry. Eczema. Okay, so I will combine. All right, so I will just tell you about skin conditions. Now, skin conditions contain 3 types. One is dehydrated skin condition. Payal, you're absolutely right. The second is pigmented skin condition. And the third is mature skin condition. So, so mature skin condition is, someone who ages gets fine wrinkles on their face, and their skin also starts getting drier, and they start getting fine wrinkles, not just around their eyes, but also on their complete face. Their skin starts sagging. So that is a mature skin condition. Second, as I told you about pigmented skin condition, there are dark spots on your face in the form of freckles, in the form of melasma, in the form of post-acne pigmentation. So that is a pigmented skin condition. And the third is dehydrated skin condition. Now, dehydrated skin condition can, we can correlate it with dry skin condition, but the difference is that the products that we use and the actives that we use for dehydrated skin condition is completely different from that of dry skin condition. Now, an acne-prone skin can be there along with dehydrated skin, because there are certain drugs that we eat which makes it dehydrated. And so we have to use certain actives for the skin, which adds in the hydration inside your skin. So 3 skin conditions: dehydrated, pigmented, and mature. And skin types, as I told you all, we have 5 skin types. Yes, Sukirti.
So we're getting a question, and Regina is asking it, how do we know what is our skin condition?
So skin condition is very easy to know, that if you have wrinkles on your face, then you have a mature skin condition. If you have pigmentation on your face, then you have, a pigmented skin condition. And if your skin feels very kitschy, and you feel that, oh, my skin keeps getting dry even after I apply a moisturizer every hour. I apply a moisturizer, and after 2 hours again it is dry, and I apply a moisturizer, and after 2 hours again it is dry, then you can have a dehydrated skin condition.
Great, thank you.
So the first step was that you should get a good night's sleep. The second step, you must know your skin type and skin condition. And the third, I already told you all, that you must follow an AM and PM skincare routine consistently. So amongst all of you, do you all follow an AM, PM skincare routine consistently? Okay, Nicole says yes. Dr. Darshana says no. So Kirti says sometimes. So a few yeses and a few no's. So people who follow their skincare routine, AM and PM skincare routine consistently, do you feel that your skin is better? Do you feel that there is a good glow on your skin when you follow it consistently day and night for months, do you ever feel that your skin gets better?
So yeah, Nicole says better, but still have pigmentation.
All right. So Nicole, you need some products for your pigmentation. So I will be getting to it, that how should you use your products, and how should you select your products. So that comes to a very, very important point, the fourth point in getting glass skin, that always use a serum according to your skin condition, and always use a moisturizer according to your skin type. So a serum is one bottle with multiple actives. Yeah.
Please repeat that, because I think we need to get that
Yeah.
which one is for the skin condition and which one is for the skin.
Yeah. So very important. Always use a serum according to your skin condition, and always use a moisturizer according to your skin type. Serum, condition, and your moisturizer for skin type. So serum is extremely important because it is lighter in consistency, thinner in consistency. It is loaded with actives. And these actives, they get absorbed by your skin and they reach the lower levels, the lower layers or the dermis layer of your skin. And it deals with all the concerns that you have. So if you have pigmented skin, use actives which are suitable for pigmented skin. If you have mature skin condition, then use actives which are suitable for the mature skin condition. So always use products according to your skin type and skin condition. Extremely important. Okay, so I think too many points, too many information. Let's play a little game, and it's called Truth or Myth. And I will be asking a question to all of you, and you have to tell me whether it is the truth or it is a myth. Also to tell all of you that today, one lucky winner who engages the most and who engages a lot in all the activities here will get a lucky prize. And I will post my new release, How to Get Glass Skin, to that one lucky winner. All right, so, so truth or myth? When you get an acne, you should apply a toothpaste on it so that you can get rid of it ASAP. Okay, so a lot of people say myth and few of them say yes. Some said true, yes. All right, we got a lot of answers. So has any one of you ever done it before, that when you got an acne and you just applied a toothpaste on it? You know, when
as a teenager, definitely.
So this is one of the biggest myths. Please don't apply a toothpaste on your acne. Please do not. It is not going to treat your acne. It is going to further harm your skin. It is further going to rip off the protective layer of your skin. So please don't apply a toothpaste on your acne at all. All right. So this is a myth. For sure, this is a myth. Now, another question to all of you. Let's just have another question for fun's sake. So Safi is a blood purifier. True or false? So there are a lot of truths here. So I just want to know, what do you really mean by blood purifier? How can anything purify your blood? Heard it, true, but never took. So how can anything purify your blood? What do you mean by purification of blood? All right. So this is the second myth that we have for the night, ladies. Safi is not at all a blood purifier. There are no toxins in the blood that Safi can ever remove, and it cannot bring a glow on your face. So while I was a teenager, so this is a confession, while I was a teenager, I had a lot of Safi because I used to get a lot of acne on my skin. And I used to drink and finish bottles and bottles of Safi thinking that it is going to cure my acne, but it never did. And I used to get so dejected that, oh my God, I had Safi and still my acne is there on my face. So everybody, please, there is no product, ever developed that can purify your blood. No, nothing can purify your blood. And there are no toxins in the blood that can be purified by just a syrup. And there is nothing that no syrup, which contain herbals, which like Safi, that can clear out your acne. It does not happen this way. You have to take an appointment from your dermatologist, get a proper treatment done so that your acne gets treated. Never ever take your acne lightly. It has to be taken seriously. You have to go to a professional so that it gets treated. All right, so let's get back to the steps to get glass skin. Now, we had finished 4 steps. Coming to the 5th step. You must apply a sunscreen even if you're indoors. Extremely, extremely, extremely important for all of you to know that sunscreen must be applied indoors every single day. Now, what happens is that even when we are indoors, the lights from the laptop that I'm looking at, these are called the visible light rays. Even these visible light rays, when they are in contact with our skin and when they are glaring at our skin, that increases the signs of aging over a period of time. So application of a sunscreen might not show you results immediately, but they protect your skin from further signs of aging on long term. So please remember this, that you must apply a sunscreen every single day. And if you want to replace a moisturizer with a moisturizing sunscreen, you should do it right away. Apply a moisturizing sunscreen instead of a moisturizer so that you get good results in long term, so that you do not get mature skin very fast. And even if you have mature skin, it does not show increased signs of aging in the coming time. All right. Okay, now we have finished with 5 points on the road to glass skin. Can anybody just tell me the first 2 points? Yes, Sukirti, sleep was the first point. The second point was the skin type and skin condition. Third was follow your AM/PM skincare routine consistently. The fourth was use a serum according to the skin condition and the moisturizer according to skin type. And the fifth was sunscreen, even if you're indoors. All right. So these are the first top 5 tips of how to get glass skin. Extremely, extremely important. Do not, leave out on any of these steps, because each and every step is extremely important to get good, healthy, glowing skin. Now coming to the 6th point. Always remove your makeup before you hit the bed. If you have gone to a party, partied long time, and then, or you have just gone to work, you've applied a normal BB cream, a lipstick, kajal, mascara, you must come back, remove it with the help of a makeup remover or a micellar water or a cleansing balm. Remove it first, because these particles, which are used in the makeup, they are extremely oily and greasy. They cannot be just washed away with the help of a cleanser, with the help of a face wash. So you must remove them with a makeup remover, and remove them with a makeup remover and then wash your face with a cleanser. So very, very important. So I included in my list to get glass skin, because a lot of people, they forget about removing their makeup off. They just wash their face and they feel that, okay, it's done. It's not like that. You must remove your makeup before you hit the bed. All right. So very, very important. 6th point, always remove your makeup before you hit the bed. Coming to the 7th point.
Just a clarity on the 6th point. So you have to use a different cleanser, because a lot of us use the same cleanser to just remove our makeup. But you're saying, no, use a makeup remover or micellar water to first take out the makeup and then wash your face.
Yeah. So there are various types of makeup removers. So makeup removers is the main category. And the subheadings are micellar water, cleansing lotion, or cleansing balms. Now, people who have mature, dry skin, they can use a cleansing lotion, because when you're removing your makeup off with the help of a cleansing lotion, that helps in hydrating your skin as well, and it removes off your makeup as well. When you have combination skin to oily skin, you can use a micellar water, okay? And even an oily skin can use a cleansing balm. So these 3 types of makeup removers can be used according to the skin type. So, if you want this ready-made information, I would recommend you to get your hands on the new book, because I have mentioned all this in detail in various chapters. So there is a chapter on cleansers, a chapter on sunscreens, a chapter on moisturizers, on serums, toners, and all these chapters are there where I have mentioned even the ideal products according to your skin type and according to your skin condition. So I've named the products as well, so that it is easy for all of you to, just buy them. And this is like a little guide which you can just put it in your bag and go out shopping and just see, okay, this is what I need, and you can just buy it. So that book contains ready-made information, but I'm here to answer your questions. Okay, so I hope that was clear.
Yeah, lots of questions, but we'll take them all in the Q&A.
Okay, sure. Now coming to the 7th point, let's just fasten it up. Always, whenever you start your skincare routine, give it some time. Give it at least 6 weeks to 3 months to show its results. Do not be in a haste. Do not think that, okay, now I started my skincare routine, AM/PM skincare routine. I just attended a Zoom meeting where Dr. Anupriya told us the tips. Now, in the next week, I will have glass skin. It cannot happen like that. It is not magic.
Oh, come on.
And then you'll say after 7 days, you did not give me the right tips. That does not happen, because you have to follow it regularly for at least 6 weeks. At least 6 weeks. And you will see the ideal results after 3 months. But for you to get the ideal results, you must also remember that you have to use the ideal products for your skin type and for your skin condition to get the ideal results that you're looking for. And if you have any condition like, high-grade acne on your face, then make sure you visit a dermatologist. You cannot treat it on your own. Okay, so my 7th point was always give your skin routine 6 weeks to 3 months to show its results. It is not magic. It does not happen overnight. All right. So let's get back to the truth and myth, because I think there is overdose of information. Let's take a little break. And now, as I told you all about the use of sunscreen indoors, what do you think that is application of sunscreen required on a cloudy day or in winters? All right, so I'm getting a lot of answers here that yes, 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 yes. Perfect, I'm so happy. This is absolutely true that yes, we require sunscreen every single day, every season, whether we are indoors or we are outdoors, whether it is winters or summers or monsoons, every single day. So sunscreen is a must. Okay. And another truth or myth. Okay. Parabens and fragrance is bad for our skin. So you'll have 4 options in this question. Which ones? So is paraben bad? Is fragrance bad? Are both of these bad or none of these? Okay, so I'm getting a lot of answers where everyone's saying both are bad, both are bad. Parabens are bad, both are bad. Okay, now parabens are bad, both are bad. Okay, so now let me just get you on with the science that why parabens are used in products. So there are a lot of products which are being marketed these days as organic products. And they say that, okay, we are paraben free, so we are more safe to use and do not use parabens. To tell you a fact, whenever any skincare product is made or whenever these guidelines are made that parabens can be used in a skincare product or a limited amount of fragrance can be used in a skincare product, these all guidelines are made by British Academy of Dermatology, and all these guidelines are tested and retested again and again. Paraben is actually, added in a product to prevent the decaying of your product that you're using faster. So it increases the shelf life of the product. It decreases the chances of any fungus or bacteria to act on the product and to decrease its shelf life. So parabens are necessary for any skincare product, and it does not cause any harm to your skin. It does not cause cancer on long term. It does not cause any harm to your skin whatsoever. It is only protective. So please remember, unless and until you have very sensitive skin and your skin is allergic to paraben containing products, you can use parabens in your products. With fragrances, there is always a little fragrance added in a lot of products. Should you use those products or not? There are some products which contain a lot of fragrance. Now, as I told you, there are various types of skins. There are certain sensitive skin types which get allergic to fragrances. For them, these products are an absolute no-no. No use of products containing fragrances if you have sensitive skin type and if you get allergic to them. However, if you have other kind of skin types or skin conditions and you've never faced any allergic reaction to any fragrance containing product, then it's okay for you to use any product containing fragrance. So do not have a block in your mind that I must not use a product containing fragrances or containing parabens. They are absolutely okay. All right? Okay. So let's come on to the 8th point on the road to getting glass skin. Now tell me, how many of you, when you were small or even today, pick on your acne or just use, tweeze your acne like that whenever you get a zit on your face? Okay, guilty. Some people are guilty for this. So it's great that if you haven't, Manisha, but then a lot of people have. Namrita has done it. Okay. So to tell you a fact, Krishan Raj, it's absolutely, a no-no to pick on your acne, to squeeze your acne, because what it can do is it can leave a permanent scar on your face. Never, ever pick on your acne. Now, some people might just be lucky, Some people might be thinking, I picked an acne. It did not leave a scar. It will definitely leave a scar. So always, as I told you, make sure to get a consultation from a dermatologist if ever you get an acne. You must consult because you need proper treatment. If you pick on acne, squeeze them, they leave a scar, they are permanent, and there is no treatment which can help in 100% removal of acne scars. So if you remember, John Abraham, even though he's not making much movies right now, even he has a lot of acne scars on his face. And he has undergone multiple treatments of acne scars. I'm not his doctor, but I know. And even now, if you see him, he is a movie star. He is in front of the camera. And he does a lot of makeup to hide his scars, but still those scars are visible. That is because he must have picked his acne bachpan ke time pe. And now, even if we are doing so many treatments, even if we are doing so much of makeup, they cannot be removed permanently. So please remember to not pick on your acne whenever you get a zit. Get it treated. Get a proper antibiotic cream when you have a pus-filled acne, or a treatment cream to correct it. Okay, coming to the 9th point on the road to glass skin. So do you think that eating right is important and a must for healthy glowing skin? A lot of yeses. So, I just want to share one thing. Now, I make a lot of educational YouTube videos, and I started about 3-4 years back. And when I made my, I was making a series of YouTube videos, and I made one YouTube video on superfoods for healthy glowing skin. And if you would ever want to visit my YouTube channel, that's in the name of Berkowits Hair and Skin Clinic. So Kirti, if you could just help everyone know that channel's name, you can go there, and there are a lot of educational videos on healthy glowing skin, on superfoods. So I made my first video on, not the first, but one of the videos on superfoods for healthy glowing skin. And it went viral. It went viral like anything. And I was like, wow, I mean, people really want to know what to eat and what is correct for their skin. So very, very important. on the road to glass skin, do not have a lot of coffee. 1 to 2 cups is fine. Absolute no to smoking, and absolute no to having increased sugar intake. All of these can lead to early signs of mature skin condition, and it leads to pigmented skin and dehydrated skin condition as well. So smoking completely dehydrates your skin. Caffeine completely dehydrates your skin. And increased amount of sugar can make your skin mature way faster. So make sure to have healthy food. And by healthy food, I mean food rich in antioxidants, a lot of healthy green leafy vegetables. Fish is very good for your skin. Proteins, eggs, very good for your skin. Have, nice citrus fruits, almonds, walnuts, very good for your skin. So have good healthy food and avoid excessive intake of caffeine, sugar, and even smoking. All right. So, do you all want a quick recap of the 9 points that I just mentioned? Yeah? Okay, all right. So, the first point, beauty sleep is extremely important. Always know your skin type and skin condition. Make sure to follow your AM, PM skincare routine consistently. Consistently is the word. You must use it consistently. Always use a serum according to your skin condition and use a moisturizer according to your skin type. Sunscreen is a must. Indoors, outdoors, winters, summers, any season, it's a must. Okay? Now coming to the night time, the 6th point, always remove your makeup or any sort of BB cream or sunscreen before you hit the bed. Make sure to do that. Always give at least 6 weeks to 3 months for your skincare routine to act on your skin. It is not magic. It won't happen overnight. Please remember that. Never ever pick on acne. It can leave a permanent scar on your face. That was the 8th point. All right. The 9th point, eat healthy, because I completely believe in stay healthy and stay beautiful. Always eat healthy. Cut down on caffeine if you have too much caffeine, cut down on smoking, and also cut down on your sugars. All right. So these are the 9 points. Before I come to the last point of the road to glass skin, I want to ask one quick truth or myth. The last truth or myth. So everybody ready for the last truth or myth? So drinking more water, more and more water, gives you a better glow to your skin. So Mehak Sharma, you were absolutely right that 6 to 7 glasses of water is more than enough. You can make it 7 to 8. But if you think that drinking 10 glasses and 12 glasses will add in more glow to my face, it doesn't happen that way. There is a minimum amount of water that your body requires, and that is about 7 to 8 glasses of water. You must have it every day. If you have just 2 to 3 glasses of water in a day, that can affect your skin for sure. But if you're drinking more water from the ideal, then that won't bring more glow to your skin. Okay, so make sure to hydrate your body by drinking 7 to 8 glasses of water. But what should you do to hydrate your skin? Does drinking water hydrate your skin? It doesn't hydrate your skin. What really hydrates your skin is to apply a moisturizer, to not sit in front of an air conditioner or sit in front of a heater. Rather use a humidifier, if you're using an air conditioner or a heater all the day. So to tell you a fact, during COVID, when in summers, a lot of people consulted me that we are sitting at home in our air conditioned rooms and we are having dry skin. This was a very, very common concern of a lot of people. So please make sure that always hydrate your skin by a moisturizer and by cutting down on exposure to air conditioner or to your heaters. If you have exposure to them, then make sure to hydrate with the help of a moisturizer. As simple as that. Okay. Okay. So coming to the last point, to the road to glass skin. extremely, extremely important. And my favorite point, whenever you want that, okay, my skin should feel relaxed and my body should feel relaxed, your mind should be relaxed too. And for that, you must take the least amount of stress that you can. Obviously, everybody has a lot of stresses in life. So make sure to meditate for 5 minutes at night. Forget about everything else. Just meditate for 5 minutes, breathe in, breathe out, and do some exercise. Give some time to exercise in a week's time, at least 3 to 4 times in a week, and be happy. If your mind is relaxed, if you have less amount of stress, you will have less amount of dark circles for sure, and your skin will be happy too. So if your mind is happy, your skin will be happy. Very important. All right, so these are my 10 points to the road to glass skin. Now I'm all ready to answer your questions.
So before we take audience questions, and I'm going to be unmuting everybody, so whoever unmutes the fastest, I'll go to them. But we want to hear about your hair, because hair loss is also one of those big issues. So I'm not going to let you go just with skin, although we only promised glass skin, but we need to find out about how to, because that is becoming a big, big problem in COVID times.
Yes, I completely agree. In fact, not just in COVID times, I had my children. So I'm mother to twin girls, and I delivered my twin girls. Oh, really? Wow. And I delivered my twin girls about 14 months back. And after I delivered, after 6 months, all my hair was in my hands. And I was like, what's happening? So that condition is known as telogen effluvium. And the same diagnosis is for post-COVID hair fall. So post-COVID, a lot of people have a concern of significant hair fall. So that is because our hair cycle has various phases, growth phase, resting phase, and shedding phase. So after our body has undergone a stress like post-pregnancy or post-COVID, our hair cycle, it completely goes into a shift and our hair starts falling. So first, do not worry, do not take stress, even though I agree, I have undergone it, so I understand that you do get stressed. But make sure to have the right supplements. Make sure to have biotin supplements every day for at least 3 months. The amount of biotin in those supplements should be about 10 milligrams. Have it consistently. You can use a hair serum containing, actives like Redensil, and Procapil and Redensil. They are very, very good active ingredients. So a lot of hair serums are available in the market, in the name of Berkowits Grow Foaming Solution. Even there is Proanogen hair growth solution, Bontress hair solution. A lot of hair solutions are there. Just apply every day, every single day, and that will help. And third, you can go for in-clinic treatments. In-clinic treatments are very effective in getting back your hair cycle in the growth phase. So treatments like PRP or bio-PRP are very effective. You can get that done, and that will really help in growing your hair back.
Thank you, doctor. And before we again take the audience question, anti-aging treatments.
Okay, anti-aging treatment. Now see, for anti-aging, I always believe in prevention is better than cure. And for that, you must apply a sunscreen, as I told you all. Application of sunscreen is very important. Something that you can do at home every day to avoid, mature skin condition early. So application of sunscreen and use of active ingredients which are applicable for mature skin. So ingredients like retinol, like coenzyme Q10, they are very, very effective for mature skin conditions. So there are a lot of serums and creams available in the market. You can buy those, use them every single day. And in the clinic, there are multiple treatments that can be done for anti-aging. There can be botulinum toxin treatment for removing of your wrinkles, for under eye hollows, for lifting up your face. There are treatments like dermal fillers and thread lifts, and there are also lasers which do a wonderful job in lifting up your face.
Now we'll take questions. I think there's so many. Reena, go ahead. Reena, go ahead.
Hi, Reena.
Okay, until then, maybe we'll ask another question. A lot of people are asking about pigmentation on face and back. What to do about that?
So, there can be a lot of diagnosis when it comes to pigmentation. So now first we have to really see that what is the cause of pigmentation. All of you, please head on to my Berkowits YouTube channel. I have a video on pigmentation, on dark spots and pigmentation. I have discussed it in length, so you will understand a lot. But to tell you now, dark spots or pigmentation can be because of, it can be freckles, it can be melasma, it can be after getting exposed in the sun. It can also be because of a condition known as acanthosis nigricans. It can be because of post-acne inflammation, dark spots. So there can be a lot of causes. Now, a lot of active ingredients which can be used to treat this pigmentation. There are lutein, niacinamide, there are glycolic acid, lactic acid, kojic acid, multiple actives. So choose the right product for your pigmentation. I would recommend to take a consult so that a doctor can tell you, okay, if you have post-acne PIS, you can use lactic acid. If you have acanthosis, you can use a product containing lactic acid. So there are certain actives suitable for certain conditions so that, it can be treated properly.
All right, Smita, go ahead.
Thank you so much, Sukirti.
Hi, Smita.
Hi, Dr. Anupriya. Such a beautiful session. I want to have skin like yours.
Me too.
Thank you.
Yeah, I just have one question. I'm 49 years old and I've never had a facial, in my life except 2-3 times random. So is it important? Are facials important? Should I start now?
So,
and what about medifacials? Because I had a few sessions of medifacials, not too many, but yeah, I did try them out, but I'm really not sure if I should go in for them.
Okay. So that's a very, very good question and not a very common question that everybody asks. Now, facials are not bad for your skin at all, especially when you have mature skin. What do facials do? The massage to your skin, it helps in, stimulating the circulation beneath the skin. It helps in draining the lymphatics, which keep all the, you can say, the dump of the skin is in these lymphatics. It helps in draining that dump off your skin. So it is definitely good. It helps in rejuvenating your skin by increasing the blood circulation. So even if you haven't had massages, and if you do these circular motions on your skin, in the upward direction, that will also act like a massage. However, when you get a professional massage done, they use products which contain certain actives which get absorbed by your skin, and that helps in giving you the desired result. And that result is not permanent because a massage can never give you results for a week or for 2 weeks. It will only give you results for about 48 hours. However, if you do it regularly, the more number of sessions you take, it will help in improving the circulation that number of times. So always take a massage session regularly so that it leaves a longer impact on your skin.
Bhumika
Thank you
is
so
asking,
much.
oh, go ahead. How to treat blackheads and whiteheads?
Okay, so blackheads and whiteheads can be treated by, at home. It can be treated by use of, there are these, comedone extractors, which have this little, hole behind. So you can just use those, press it against the blackheads and the whiteheads, and it will help in removing it off. So just apply a moisturizer in that area, press, and then it'll help. However, you can even get it done professionally in a medical clinic, and they can be removed by a professional's help.
Nidhi, go ahead.
Hi, good evening, everyone. This is my first session with Sipping Thoughts, and I'm really, really enjoying it. This has been a recommendation from one of my very close friends here. So, Dr. Anupriya, thanks for your time. I have a very sensitive and dry skin type. I'm 43 years old. I have been following a AM/PM routine. And I've tried my hand on different products, but since my skin is so sensitive, I end up using it for a couple of days because it leaves an itching or irritation on my face, and at times redness also. I have tried few dermatologists, but my experiences were not good. Recently, I tried products of Kama, and I've been using it from last 4-5 months now. There is no irritation, and I'm glad for that, but I don't see any change in my skin also. Since I'm 43 and I can see small, little wrinkles and lines on my face now. So, but I have a fear of approaching dermatologists and using the medicinal based products for long term. So I just want an insight on this.
Nidhi, you need a dermatology consult. I know you have been to a lot of dermatologists. So I don't know if you have shared this information with them that you have sensitive skin. And there are certain active ingredients which lead to sensitivity in someone's skin.
Okay.
Now, do not be scared to use dermatology based products because they are formulated for your skin. And if you have dry and sensitive skin, you can go for products containing hyaluronic acid that might suit you. However, I'll have to look at your skin to tell you the exact product that will suit. Colloidal oatmeal extracts are also extremely good for sensitive skin. But as I told you, do take a dermatology consult for getting an ideal advice.
All right. Thank you. But then I would like to take a consultation from you. Please let us know how can we reach out to you. Thank you.
So one question has come up, and this is an interesting one. Face yoga and pranayama exercises, do they help in getting glass skin?
So that's a very good question, actually. So face yoga and pranayama exercises, as I told you all, amongst the 10 points on the road to getting glass skin, it is one of the points which is extremely important to give you relaxation, mentally and physically. And that definitely helps in getting glass skin, but that is not the only thing which can get glass skin. There are 9 more other points that you have to follow to getting good, healthy, glowing skin. So just do not depend upon yoga and pranayama, but it is very important to give you mental relaxation and have a glowing skin.
Go ahead, Holistic.
Yeah, hi. I use most of the natural remedies, for skincare. Just an advice on 2 things. I use ice as a toner for my skin, and I also use beetroot as a blush on my skin. So would you advise it, and what is your view on it?
Absolutely no problem in using it. So if you're using an ice as to shrink your pores, it's great. It's a good home remedy to do that. But please remember that it gives you temporary results. It does not give you permanent results. So if you're going to a party and if you want that, I want my pores to shrink immediately, just apply some ice and that will help in shrinking your pores. About beetroot as a blush, why not? You can use it, no problem. If your skin is not getting any allergic reaction or is getting sensitive after you use that beetroot as a blush, you can definitely use it.
So Sarita is asking, I have a lot of open pores because of pimples. I took so many treatments, but they don't work. My skin is sensitive and thin.
Okay. So, hi, Sarita. Now, open pores, another very important topic and a major concern for many, many of us. Now, open pores can be caused due to 2 main reasons. One is that it can be caused due to excessive oil production, and it can be caused due to mature skin. Decrease in the strength of the collagen and the elastin, which supports our skin. So as the collagen and the elastin, it goes down, the duct of the pore, it sort of shrinks. When there is increased, oil production, the mouth of the pore, it increases. So what do we do? When you have open pores, make sure to use the right actives in your products. One active, which I would highly recommend for open pores, is retinol. Retinol not only decreases the oil production, but it also improves on mature skin condition, and it improves the collagen and the elastin in your face and in your skin. So use retinol containing products, but make sure that your skin is not sensitive to retinol. Do a patch test on your neck because a lot of people are sensitive to retinol. So you can use retinol containing products.
We're getting a question on sunscreen. A lot of people say they get sweaty after that. Why is that?
So there are a lot of formulations of sunscreens now available in the market. If you get sweaty after application of a sunscreen, there are various sunscreens now in lotion form, which are very good. So I'll tell you a few. Avene Day Protector Sunscreen is a lotion-based sunscreen, which is excellent and which can be used by all of you, right? And even Bioderma Aqua Tint Clair is a very, very good sunscreen. It has a little tint and it is very thin consistency, which does not lead to increased sweating.
So Chita, go ahead.
Thanks so much for this session. Excellent. information. I wanted to know, I'm 49 and my skin looks okay, but I do know that, it can definitely pep more with treatments, but I'm very, very scared to go for any treatments like laser or fillers. I do see sunken eye, under eye especially, and even the aqua lift or the thread lift. Are these safe in the long run, or are there any side effects? If you take these treatments, if you take it once, you've got to repeat it in a cycle of 6 to 12 months or whatever. So just wanted your point of view.
First, I would want to tell you that whether you would have to take these treatments after 6 to 12 months. Now, every treatment has a life. If you take dermal fillers, they will have a life for 12 to 18 months. If you take botulinum toxin treatment, that will have a life for about 4 to 6 months. However, when, after 4 to 6 months or after 12 to 18 months, your skin condition will never get worsened. It will only come back to its original, even when the effect of the treatment goes. So do not be scared in taking any of the treatments, because it will never make your skin worse. On the long run, it has absolutely no side effect, because we inject hyaluronic acid in your skin when we are injecting dermal fillers. Botulinum toxin is a protein-based solution, which helps in relaxing your muscle. So very important thing is that you need to get it injected by an experienced injector. If you get it injected by an experienced injector, absolutely fine, no problem.
Divakar is asking how to cure black color around both sides of the nose and forehead.
On both sides of the nose and forehead, all right. So Divakar, pigmentation on the forehead can be because of a few reasons. It can be because of post-acne pigmentation, or it can also be a condition known as Reels melanosis. So Reels melanosis can be because of dye application in your hair. Now we need to first identify the cause, why it is so, and then use products containing, skin lightening agents like glycolic acid. Using glycolic acid 10% can help in decreasing the pigmentation. One of the very effective creams is D-Melan cream. D-Melan cream, very easily available online, and even in chemists, you can use that. Now, pigmentation around the nose, it can be even due to fungal reasons. So again, we need to see that, we need to examine first. And then if it is because of a fungal infection, then it has to be treated accordingly.
Now, Minita is asking, can we take supplements for hair and skin on our own? The second question, again, around supplements is about collagen powders. So both of them, I'd love to get your view on.
Okay. So can you take supplements for hair and skin on your own? First, for hair, if you have significant hair fall, as I told you, 10 milligram of biotin, you can take it on your own for 3 months, for sure. No problem at all. For your skin, there are various supplements in the market, and there are various actives in the market which can be suitable for your skin, which might not be suitable for your skin, which might just go waste. So for skin, according to your skin condition and skin type, a doctor can recommend you products. So these nutritional supplements, like some of the supplements which contain fish oil, some of the supplements which contain flax seeds, these are ideal for dry skin types because they moisturize. These are oral moisturizers. Some, skin supplements contain glutathione, vitamin C. These are ideal for pigmented skin condition and for getting a good glow on your face. So you can take supplements on your own, but be sure that it will suit your skin type and skin condition. That's all.
So there's a question that's come in, again, when you said glutathione, is it okay to undergo glutathione treatment for skin whitening?
So glutathione treatment is one treatment which is effective for skin lightening, but be sure to keep this in mind that no treatment is permanent. If you take glutathione treatment, like about 6 to 8 sessions or even 10 sessions, you will get wonderful results. But after about 6 months, your results will be back to normal. So if you really want to try the results of glutathione, I would recommend you to try oral supplements of glutathione. Have it for at least 6 months. You will see a significant change, and then slowly and steadily stop it over a period of another 3 months. You will see some permanent changes that will happen to your skin, and make sure to follow a regular skincare regime along with it and continue it later.
Now, Sunita is asking, please suggest a good and effective sunscreen and what SPF is good enough for the skin.
So if you're indoors, SPF 30 is more than enough. If you're outdoors and you're in the sun for more than 2 hours every day, make sure to apply a minimum SPF 50. Okay. Now, good sunscreen, it totally depends upon your skin type again. But, something which does not sweat, as I told you, Avene Day Protector, even ISDIN, ISDIN, Fusion Water Sunscreen. It is SPF 50. Very good sunscreen.
Now, doctor, we have a treat for us, I think, because you are traveling. And I know a lot of us now are getting out of this COVID thing and want to go. So she's going to show us her travel bag, and we will end with that even when you're traveling does not mean you cannot follow good skincare.
Yes, this is I'm traveling. I'm in Bangalore right now, and I'm here with all of you from Bangalore. And here's my travel skincare bag, and I always carry it. I make sure to remind everyone in my family, have you carried a sunscreen or not? So when they ask me, sometimes your family members ask you, okay, what must, just remind me, what can I forget? Carry a sunscreen. That's something that I always remind everybody.
People want to know that if they want, they can consult you in Bangalore.
Oh, I'm so sorry. I'm leaving tomorrow, but we can have an online consult. We can have an online consult. I will leave in my phone number with Sukirti. And you can share it, Sukirti, with everyone. We always can have an online consult. So this is a face wash that I have. This is called the Avene Cleanser. Avene Cleanser. This is one of my favorite cleansers. I have a combination skin type, and this really suits my skin. I use it day and night, and not just as a small bottle, but I even use it at home. I love this cleanser. After I cleanse my face, I make sure to spray my face with this Indulgio Essentials Pore Minimizing Toner. It's a green tea toner. So I just spray it fast, and then, I'm done. Now, I really like these Dr. Reddy's Vitamin C and Retinol Serum. So this is the Vitamin C Serum. I just apply the serum after I apply the toner. So I just have to take out a capsule, break the capsule, and apply it. Very travel friendly, and very easily available in the market. Now, my favorite sunscreens that I also mentioned to all of you. So I have a small little bottle of it. It's called the ISDIN Photo Protector Fusion Water Sunscreen. My favorite sunscreen. It's really thin in consistency, and it will not make your skin sweat. Trust me on that. So these are the products that I use in the morning. Then I use my BB cream. This is also something I love. I never use a foundation. I just use a little drop of this BB cream. So this is a medicated BB cream. It's called the No Reva Exfoliac BB cream. And I love this BB cream because it is, just a little drop. It is non-comedogenic. It is good for my skin. And, it makes my skin glow even further. Now, this is a lip balm. I always carry a lip balm with me as well. And after I do my skincare routine, I apply this lip balm on my lips so that they remain hydrated as well. Now for the night routine. For the night routine, I follow a lot of steps which are similar. So I first take off, I don't have the makeup remover here, but I make sure to remove off my makeup. Then I cleanse my face again with the Avene Cleanse face wash. Then I spray the toner again. Then I use the Dr. Reddy's Vitamin A. So these are also in capsules. So these are these small capsules which I use. And after that, I use a cream at night, which is the Skin Boost. So this is a new company which has come up, which is called the Dermatica company. Extremely good products. And I love them, and I use them every single day, day and night.
Well, thank you, Dr. Anupriya. That was amazing. I think I'm going to have to watch this video like 5 times to get all the tips. But any last closing thoughts as we end for today?
I completely believe in this, that makeup and photo filters, they might go out of fashion, but glass-like skin will always be in. So always stay healthy, stay beautiful, and always enjoy healthy and glowing skin.
Well, thank you. And thank you everyone for joining us today. I know you guys had a fabulous time. I did. So much to learn.
So all of you, you can follow me on Instagram at Dr. Anupriya Goel. I will be posting the same video over there. On my Instagram ID, I have mentioned a contact number in my bio where you can call and take an appointment. But please remember, I'm traveling for the next 2 days, so I'll be taking appointments only after Monday. All right.
I think you can have a long list.
All right. Thank you so much, Sukirti. It was just lovely being here. Thank you so much.
Thank you.
I hope to come here soon again.
We'll be having you back soon.
Okay, bye everyone. It was lovely.